Yes, it is sugar, and you won't believe how much of it is in your diet. Researchers say the average American downs 152 pounds of sugar every year. So why do we love it so much, and how can we burn it all off? The Morning Medical Update starts right now. And good morning, everyone. Glad to have you with us. It is Thursday, April 28th. Thank you for joining us here on Facebook, YouTube, and on Twitter. Coming up later, what are the best parts of Kansas City? Out-of-towners attending the NACTO Cancer Conference here in town. They're going to share some of their favorite spots here in Kansas City. We'll hear from them in just a bit. At 8:15, Dr. Hawkinson joins us with our latest COVID count and headlines. But first, who doesn't enjoy a muffin or a donut to get the day going? Why must we do it? The reason we have become so addicted to sugar and the best ways to burn it off. We're going to get those answers for you here coming up in just a bit. So get your questions sent in to us on YouTube, Facebook, and the Medical News Network. You can find links to those. Well, you know the links. They're not on your screen, but send them in. All right, everything here looks really good. You can see yummy stuff right here. It's a bunch of sugar packed right here in all of our favorite things. Lots of processed foods contain sugar, as you know. It is the most popular ingredient added to foods in the U.S. In fact, Americans are eating an average of 42 teaspoons of sugar each and every day. Soft drinks, of course, are responsible for most of that added sugar. And do we have the chart, guys, that we want to show where most of the added sugar comes from? We got that? Okay. So we mentioned that soft drinks, tea, breakfast cereals, candy, baked goods, you name it. That's all the bad stuff, but it's all the stuff that we love. So when you see a chart like this, it's clear how we eat so much sugar in just one day. It can be tough to put it down mentally. It's hard to put stuff like that down. You may be surprised to learn that many of our trigger foods are engineered to have this effect on you. Alexis Del Cid has that story.
We all have that one food.
Chocolate.
That trips our trigger.
Pizza.
Chips.
Lay's potato chips got the commercial right.
You know you should stop.
Chips.
Sour gummy worms. Once I opened the bag.
And you just can't.
I can't stop at just one, even if I hide it somewhere in my house.
I get to the point where I know I'm full and I just keep eating.
Do you feel regret when you're done?
Oh yeah, definitely.
So what is happening in our brains to make us keep eating even when we know intuitively we've had enough? Why do we keep going, knowing we're not going to feel good when we finally do finish? It's no accident, and you are not a failure. It is intentional, and there's a name for it, the Bliss Point. The point in which food manufacturers pour just the right amounts of sugar, salt, and fat into all the foods we love, overriding our body's natural mechanism that should tell us to stop eating. The Bliss Point is what keeps us going back for more and more and more, and it can have devastating consequences.
Why we love sugar so much, why we can't say no. Clinical psychologist Dr. Greg Nawalanic, and of course, Chief Medical Officer Dr. Steve Stites. How are you guys doing today?
Great.
Good.
I think I need sugar.
I know, right? I just, so we got to talk about this. The Bliss Point. I mean, I think we've heard about, it makes sense that companies would inject something that would make us want more, Dr. Nawalnik. But to hear that word, the Bliss Point, does it make sense to you now and help us kind of understand what it's doing to us?
I mean, it does. It basically is hot wiring our pleasure center. So when we think of the Bliss Point, it's a combination of three ingredients. It's sugar, salt, and fat. And they figured out a way to get basically the optimal levels of each. And it's a additive effect. So basically, ironically, additive for additives. But they try to mix at least two, maybe all three, if they can do it, of these ingredients together to basically trigger this dopamine release, which is the neurotransmitter that's involved in our reward center of our brain. And so it's basically like you have one bite and your brain's like, woo, that was cool. And then it wants to do that again. And it's essentially the same, reward center that's involved in, addiction for actual like substances. Also, great experiences that we share, and just any sort of reward.
Well, and think about it, because I can stop eating my steamed broccoli. I mean, I'm like, okay, I'm going to choke this down. But for some reason, you're right. I keep going back for more and more and more. So you're saying it's not just physical because it tastes good, but it's happening in the brain?
Correct. Yeah.
Wow. Okay.
And it tastes good.
And
It does. I know it does.
It tastes good, feels good, and also there's a bit of like, I shouldn't be doing this. Oh boy,
Right.
that comes in too.
Well, and then there's just marketing genius behind all of it, because I think we all fall into that. But certainly during a time of a pandemic where we're looking and turning to comfort, I'm going to talk about some of the medical effects on this on our body in just a second. But just during a pandemic, we turn to food. I mean, is it because we're sitting in our houses, or because it really brings comfort to our lives?
Well, there's a couple different pieces to that. One is, yeah, sure, we want to self-soothe in any way that we can. And while people try to think, oh, at least I'm not hitting the bottle, or I'm not using drugs. It's like I'm just having my chips or my donuts. It does have a long-term effect and impact. And, and the reality is that this also kind of goes back to caveman evolution, where stress was associated with either a food scarcity or that you were about to become something else's food. And so when we get stressed, our brain tries to pair with one of these two stimuli. It's like, well, is something going to eat us? No. Well, then we'd better eat so that we can pack on some pounds to get ready for the lean season. So
true.
Wait.
Okay,
You just
go.
called us cavemen. I'm just saying. The whole thing is based on
Cave
so
people.
Lay's
And you-
potato
and you
chips
say
are
it's so-
related to cave people.
Right.
There you
It's
go.
not that we're not that far from the caveman, right? Dr. Stotts. So, okay, so then you're telling me that the same, just so I understand you right, the same addiction though that happens with food is the same that happens with drugs and alcohol?
No.
No, it is
No,
not.
I'm not saying that.
Okay, I just want to make sure. Okay, so that's why I wanted to clarify
Right.
that is it mimic it in a similar way, you're saying?
So, I mean, the jury's kind of out on this, and it's a hot source of debate and discussion about, is sugar actually addictive? And does it produce a physiological response? Can it alter brain chemistry? Does it change our behavior? All these things, the boxes are getting checked. But it's, and are there also withdrawal effects? To some degree, I guess, there could be some irritability when you try to stop these things. But the real thing is the deleterious long-term effects of continued use. And so we try to steer away from the idea of addiction, but there are studies with rats and even humans that show that when this pleasure center gets tricked, it does largely mirror and look a lot like other addictive responses, but there's still, the jury's kind of out, and we don't want to jump to the word of using addiction for sugar.
Yeah, it's a pretty strong word, especially
Yeah.
when you're comparing it to other people's really
But there is a
rough
certain
addictions.
dependent response
Sure.
that they can
We like
develop.
it. We like it a
Sure,
lot.
yeah.
So,
It's
Dr.
habit forming.
Stites, this goes on long enough. Now we're talking about effects on our bodies, and we're learning more and more as we know. But let's talk about inflammation. How does sugar, we talk about sugar causing inflammation. How does that work in the body?
Yeah, that's a good question. It's funny. Preparation for this show was rereading some of the information about sugar over the years, and about every 3 years we change completely our belief about what sugar is doing to us, and it's almost always a bad conclusion, but the mechanisms. It was before simple carbohydrates like just pure granular sugar.
Yeah.
Which you seem to have a lot of on your
I
desk
do.
here,
It's
Jess.
all mine.
Was really bad for you, and it could
Right.
cause inflammation in your body, which can lead to problems with end organ disease and kidney disease and heart disease and lung disease and brain disease and basically body rot. And so then it became, well, really other studies say, well, look, it can also be true with complex sugars. The problem is that with simple sugars like that, the amount of sugar you get, it's so concentrated in just plain sugar. There's nothing to kind of buff it out. In other words, you'll just keep eating so much of it. Like I would eat chocolate chip cookies, which I could eat all day long, actually. But then there's these complex sugars, which may be in fruits and vegetables. Well, there's other stuff in them. There's water, there's fiber, so you won't eat quite as much of those. It's a little more challenging to get a whole lot of it. So at the end of the day, I think what we can really say about sugar is what we say about everything else. All good things in moderation.
Right.
As long as you're willing to have some limits on it, the entire bag of Chips Ahoy chocolate chip cookies is probably not good for you. 2 or 3
Newsflash.
yeah, a couple of them. Yeah, okay, fine. And in fact, after this episode today, I'm going to go get a chocolate chip cookie in the darn cafeteria.
You've mentioned this 4 times now.
And I'm going to eat it.
Okay.
I am going to eat it. But I also know that there's some, actually in the New York Times this morning, they were talking about some research that looked at sugar and causing migraines, right? Simple sugar, does that cause migraines? Yes, it does. Research in 2018. Research in 2020 says, well, maybe it's the symptoms you get before you have a migraine that makes you feel sick, and you want something kind of easy, and then you start eating more sugar. So which one came first?
Right.
Or I think at the end of the day, what we're going to learn, Jess, that the answer is yes. It's the same thing every time we have a big diet fad, right? What's the latest diet fad? I'm going to eat a lot of sugar, so I don't eat fat. And what's the next diet fad? I'm going to eat a lot of fat, so I don't eat sugar.
Right.
Well, okay, really, what we have to do is be sensible and sensible. Sensible and sensible. Sugar sickness is bad. Too much sugar, bad thing. But do it as a part of your normal diet. Do it in moderation, and it's not going to cause diabetes like that. But when you go out there on a limb, you start having a lot of it, then you start jacking up your glycemic index and other things because your food sources are so rooted in it. You end up having some problems with insulin resistance in your body. Then you want more sugar, and then pretty soon you're on your road to diabetes, plus you're on your road to obesity. And once you're on the road to obesity, you get a lot of that. Hawkeye is a dietary maniac. We gotta ask him about some of the sugar thing, 'cause he doesn't
Dr.
like good
Hawkinson,
stuff.
I want to ask you because and we're going to actually hook up with your nutritionist who's going to join us here in just a few moments, Kelsey. But you said, you've always been fit, but you said, I really want to work on my diet. What were your thoughts? And with sugar, where did sugar land in your process of trying to get healthier and better?
It's definitely trying to cut out those sugars, just like Dr. Stites was saying. I have a significant addiction to Sour Patch Kids. I know we're not using addictions.
Cherry sour drops from the Cherry Republic.
But
Holy
all
cow.
of those are good. So I think it's overall just trying to reduce that sugar, also reducing the fat. I think, diet in moderation, just like Dr. Stites said. I think one of the most healthy diets that we continually hear is that Mediterranean type diet with certain oils and nuts and protein like fish and lean meat is probably the healthiest, but it's all in moderation, but it's also in that combination with physical activity, which is extremely important. We'd have to talk to our endocrinology colleagues, but I think a lot of it is when you have excess sugar, that hemoglobin A1C is kind of that measure of that, and that's what a lot of diabetics or pre-diabetics monitor. But I think what it is just glycosylating, meaning adding those carbohydrates, like Dr. Stites said, or adding those sugars to other areas in your body that it shouldn't be there. It just impairs function, increases your risk of heart disease, stroke, and all of those other complications as well.
And what's really disappointing? How much exercise it takes to burn off sugar.
We're going to learn that in a minute.
Yeah,
It's not going to be happening.
It's tough.
It's not going to be happening.
Next.
Don't think you're going to do that. If you want to walk 20 miles, go ahead.
Yeah,
But
no
that's
fun.
what it takes to burn it off.
Not for a bag of those cherry gummies, though, that you like and that you gave me, and I wolfed down and had
Those are
felt sick
good.
for a day.
Yeah, but they were good.
Thanks.
Yeah.
So, but Nawalanic, I have to ask you because we both have young kids, and I'm always constantly just no sugar, no sugar. And we had somebody come on here once and said, try not to make sugar such a big deal and so evil with your kids, because constantly telling them how bad it is, how bad it is. I mean, I can't imagine how a kid processes that. But that's, but then diabetes, as a parent, you're like, oh my gosh, is my kid going to have that? And so I want to be clear, sugar does not cause diabetes, because that's a question we have gotten before.
Yeah,
Correct or not correct?
Well, which year of research do you want to believe? I think it's a challenge. Sugar, if you eat the right amount of it, does not cause diabetes. But the problem is we've identified it. Folks have this bliss point, and the bliss point is sugar and fat. And people tend to eat a lot of foods that are high in sugar and fat content, which leads to obesity, and obesity is clearly related to diabetes. And so I think we have to be careful with how we say this. The answer is all good things in moderation. Eat a healthy diet, exercise regularly. It's really boring, but folks, it's kind of like wearing a mask. It works.
It works. All right. I do want to, we talk about diabetes. Let's talk about Alzheimer's, because studies have shown the risk of developing Alzheimer's disease among people with diabetes is 65% higher than that of those without diabetes. And people have called Alzheimer's like a type 3 diabetes.
Well, no, I'm saying, okay, I get what you're going, but the reality is that when you have diabetes, your blood's stickier, right? When blood is sticky, it tends to cause a blockages, especially in small blood vessels. You start getting this chronic injury in tissue, and they don't get enough oxygen. that leads to some of the changes we see in Alzheimer's disease.
And the brain.
And the brain, and your heart, and your liver, and your kidneys, and your name it, right? And so at the end of the day, what's the answer? It's the same thing we always say. It's all good things in moderation. It's when you start thinking, I can eat anything I want because I'm going to go walk 1,000 steps. I have some of my patients come in and they say, Doctor, I walk 3,000 steps. Yep, not very much.
Right.
But it's 3,000 steps. 3,000 steps. I'm like, yep. You know what? Not nearly enough.
Yeah.
So it's all about moderation.
Does sugar feed cancer? That's something that people hear. Yeah. It's just if you have cancer, stay away from sugar. It's the enemy.
Yeah. Right. I sound like a broken record. Like I really don't know anything new to say here. But again, what's the reality? The reality is that any type of disease can be linked to the excess consumption of certain food groups. Does too much fat cause cancer? Too much fat causes colon cancer. Yeah, it can cause cancer. What about too much sugar? Sure. Again, the problem is you can't look at it and say, it's just guys, I eat teaspoons of sugar every day. It's because I'm eating teaspoons of sugar and it's processed, and really I'm not having any other healthier foods, and I don't have enough dietary fiber, and I don't have enough, antioxidants, and I'm probably not going to exercise, and I'm going to feel terrible all the time. I'm just going to sit on the couch and watch television, and pretty soon it's all linked together. It's not just one thing.
All right, so how many miles is Earth from Jupiter?
What?
I thought I was just breaking your broken record.
Live long and prosper.
Although you probably would know the answer to that. That's why. All right, let's get to Dr. Hawkinson and our COVID count today. Good morning.
Hi.
Hi.
COVID count's doing well.
Okay.
I think we should also add too, alcohol is a large contributor to carbohydrates and sugar. Yeah. So right now, again, active infections in the hospital remain in the single digits. 6 active infections, 1 in the ICU, 0 in the ventilator, still 11 in that recovery period. We will try to get some information because I know there was a community question on the aspects of those cases, vaccination, comorbidities, etc. We will try to get some of that information.
Hey, what we do know is that 90% of all our ICU patients are unvaccinated. That has still been true, and also all of our deaths are unvaccinated patients.
All right, this has been a long time coming. Moderna is seeking emergency use authorization for kids 6 months through 5. What does that mean as far as time? Give us a timeline.
Also Peter Marks with the FDA did do a podcast, not a podcast, but a YouTube. I think it's called In Just a Minute. It's from the FDA. He talks about that. They are currently reviewing all that. I think that is extremely important, especially for those families or those bubbles, whoever that may be, that have those young children that really want them vaccinated. I think it's important. I still think we are probably not looking until till June, but they are being very detail-oriented in following that data analysis so they get the right information so that when they do put out that, it will be okay to go ahead and do that. They're looking at everything, but they are continuing evaluating it. I think it's good news, and we'll see what we can do because we know Omicron affected a lot of children. And we've also seen some seroprevalence studies that came out this week talking about how many people have been infected in the United States, and a vast majority of children have been infected since the pandemic began. So overall, I think it's good news. I think we're still probably going to be waiting for a few weeks, but at least this is one further step to get there.
A couple of thoughts. So first of all, 75% of kids have had COVID, and so that's a huge number. It shouldn't surprise any of us. Number 2, the effectiveness of the vaccination in children isn't like it is in adults. It's still good, though, and I think to Hawk's point, can probably decrease some of the multi-system inflammatory problems you have, and especially with kids, they have a higher rate of hospitalization and even a higher rate of ICU stay with Omicron. So I think there's good news on the horizon. I think it's a good thing to think about. What we don't know yet with children, especially, is if you've had it, how long that natural immunity is, and what's the interplay between vaccination and immunity, and so natural immunity. So we don't know, but I think if you have a young child, I think the Moderna vaccine is going to turn out to be very safe and fairly effective.
Yeah.
Dr. Stites, Dr. Fauci says that the U.S. is out of the pandemic. Thoughts?
Yeah, no, I think we are in a whole different phase of life, right? And what we have to do is move out of pandemic thinking, where we are in sort of that lockdown mode. Everybody's masking all the time, etc. And we have to move into the mode of being Jack be nimble, Jill be quick. I'm trying to be ecumenical there, but you have to be ready when things are better, as they are now, to go ahead and be much more, go about the natural world as we experienced it prior to March of 2020. When the numbers rise again, and when I think we will see various waves come through, we have to react to those, and we have to react to take care of each other and take care of ourselves. And I think that's what's meant by endemic. The flu is endemic, and so every year, what do you do to handle it? You get a flu vaccination. And if you're around people that are sick, you try and wash your hands, you try and wear a mask, you do the things you can do to help take care of yourself. I think, Hawkeye, I think we're going to be doing the same thing with COVID for a lot of years.
Yeah, I mean, I think so far what we've seen is there's been really no seasonal variation. We've seen it infect huge surges, SARS-CoV-2, huge surges in the summer. We may be getting to that where there may be now some seasonality to that. It's hard to say. We'll see how that goes. And I think we really need to ask the questions, what does that mean by endemic? Just as you said, Steve, does it mean lessen restrictions? We know some areas have gone back to mask mandates or tried to do that. What does that mean? Does it mean supply chains? Does it mean that we need to brace for capacity issues in the hospital? All of these things are quite different. They're quite different questions. But what we are hoping is that there is enough population and individual immunity, either through vaccination and infection or reinfection, that we don't have those capacity issues in the hospital with so many people coming to the hospital, so many people go to the ICU, and of course dying. So I think that's important to understand. But just for our audience, just understand that the virus is out there, it's still circulating, and just do everything you can as an individual to protect yourself and your bubble.
All right, let's bring Dr. Greg Nawalanic back in, clinical psychologist here with the health system. We're just talking about sugar, addiction, how to come off of it. So we've talked about these hidden side effects. I don't know how hidden they are, but they're, they have effects on our body and our organ and so on and so forth. But I want to ask about sugar and depression. Any link there?
Well, so, I mean, there's kind of this self-feeding cycle that can occur. With depression, the depression tends to change our cognition so that we have kind of a darker view of things, and we do tend to reach towards things that might self-soothe us somewhat. And so sugar intake can increase with that, and then unfortunately what happens is start to pack on some pounds, and then that kind of, it's a cyclical problem where you start to then feel worse and get down on yourself because of the couple extra pounds, the way your clothes are fitting, and then you, as you're uncomfortable, you want to reach for more comfort food. So it's kind of this vicious cycle that can start. So there can be some relationship between depression and sugar.
But if somebody really needs to get off of it for health reasons, any way that somebody could do that and be successful coming off of it, how would you advise someone? Just even just mentally, we talk about Noom. I always say there's a Noom sense, that app
Sure.
where you have to mentally get behind it versus physically. But any advice you would give on
Well, I think
mental?
number one, when we look at any sort of behavioral change, we want to try to have less emphasis on critical thinking, self-flagellating thinking, where we really shame ourselves for mistakes. I think that the more positive our orientation can be of, hey, here's this bag of chips. If I eat it, I know what's going to happen, how I'm going to feel. Let's not do it. Let's make a better choice. Let's go either go for a walk, go have something healthier, engage in some positive activity, something that then afterwards you're able to look back and say, wow, I resisted that urge. I did that. I made a positive choice for myself. And then that becomes a habit for me. The more often that you can do that, it feels good. It releases good chemicals as well. When we make a good choice and we're able to look back and say, I did that. And it gives you a belief in your self-efficacy, your belief for positive change, that you can actually accept responsibility for positive behavioral change and say that I'm part of my improvement. I did this.
All right, once you bring it in, you got to burn it off. So one way to burn off those calories, of course, is through exercise. So we want to get out to the Sports Medicine and Performance Center out south with Kelsey Inget. She is joining us. Kelsey, we've been talking a lot about sugar, and now we're trying to figure out how do we get back on the right track and find that balance. So first of all, how does the body burn sugar through exercise?
So there's two main energy systems in our body that create the energy that we need to exercise. There's aerobic system and there's an anaerobic system. So one common misconception is that you just will go do cardio all day to burn off your sugar. I'm going to log 30 minutes on the elliptical and hopefully I've burned off some sugar. But that uses our aerobic system, and our aerobic system in our body does not actually use sugar as our primary source of fuel. So you want to use your anaerobic systems. which your primary source there is carbohydrates and sugar. That being said, that is more of our muscle system. So if you think of strength training versus cardiovascular training, strength training is a better way to use sugar specifically as an energy source.
All right, well, we're all going to sit here and we're going to let you do what you do best. And I want you to give us some exercises and tips of things that we can do if we're not able to come out to the sports medicine and performance center. Are there things that we can just do daily and incorporate in our lives where we're trying to find that balance? Give us some moves.
For sure. Okay, so I'm going to show you some moves, but the biggest thing is that you want to think that you want to tax your muscles. So your fitness level is going to vary. So if you are brand new starting out, you can just use your body weight. But if you are more of an avid exerciser, you want to add some kind of resistance so that we break into that, again, anaerobic fitness system. So I'm going to use a couple easy things here that people often have at home to add a little resistance instead of just body weight. So I'm going to use my band here, and I'm going to do like 10 squats. So what I tell people is think high intensity, short duration. So it actually is doing less time, but doing it more intensely. And that's also why I'm adding resistance to that. So doing a little circuit where I did my squats there with a little bit of resistance. You can do this across your living room, lunge over. You could do a body weight exercise here if you needed to, like a push-up, or you can grab, a set of dumbbells. I'm going to work my muscle systems again. So using the resistance there to make sure that I am keeping my heart rate up, challenging my muscles. Again, you can lunge back, create a different exercise. So doing this for even 10 minutes of challenging yourself but keeping your heart rate up is going to burn more sugar than 30 minutes on elliptical at a steady pace. So any of these moves that I'm doing, or like I said, body weight type stuff, is going to be what you want to do, whether you're at home, at the gym, in the office right there. It can be done anywhere.
Well, and I think that's it. The gym isn't for everyone. Not everyone has that time. I look at those and I think I could do some of those while I'm brewing my pot of coffee in the mornings. So those are those things just to kind of get little things in at a time. Kelsey, you share a chart with your clients, and you've dubbed this the think before you eat chart. For example, a glazed donut, you need to do 88 minutes, not 88 minutes of crunches. Dr. Seitz, you were talking about that too.
I was reading about this last night, actually. But, this is a lot of crunches. I would have I worked out this morning for 45 minutes with Andy Spear on the Peloton app, and this is great. But 88 minutes of crunches? Holy moly.
Well, and I kind of liken this to like when you go to restaurants and now they put the calories. It really changes and shifts the things that I choose, because I'm like, oh wow, it's right there in your face, and I'm thinking, when in the world am I going to burn off 1,700 calories?
In an intense hour of exercise, you may get 200 or 300 calories. Okay, so that's like one granola bar, guys, and that it's just not a lot.
So how effective is that, Kelsey? Then when you're walking and talking them through that, and does that mentally get with them to say, hey, and I know when I work out at the gym, I go home, I don't eat anything because I don't want to just ruin what I just did. So how effective is that with your clients?
So my famous saying is you can't out-exercise a bad diet, because that is a common thing that people do, is actually reward themselves. Like, oh, I went and did 30 minutes at the gym. Now I'm going to go home and it gives me a little leeway to go ahead and sit and eat this thing of ice cream, or to indulge yourself. And just like that chart shows you, it's going to be really hard to out-exercise a bad diet. Unless you are exercising 24 hours a day, basically. If 88 minutes is one thing, it's just not feasible. And so just like you guys have been saying, it's really about moderation and it's about consistency. So instead of thinking like, I'm going to exercise off this donut that I ate, it's more about consistency in a lifestyle, and so exercising daily, only eating the donuts, infrequently or occasionally. It's really about creating that balance more than thinking, let me burn this off and then I'm good, because that gets a lot of people in trouble.
Well, maybe we can help this sink in for folks today. Bring that chart back up, because one slice of cheesecake, 148 minutes of brisk walking. When in the world would I have 148 minutes for that one thing? Not to mention all the other stuff. A milkshake, 72 minutes of jumping rope. Here's the one, a grande cafe mocha.
Think about that.
87 crunches.
People do this, get 2 or 3 of these a day. I mean,
yeah.
holy
Right.
cow, that's like 2 or 3 meals right there, right?
A
If you think how
Coke.
many calories
I
are in
do
those,
love my
yeah.
soda, but I cut it out recently. But 17 minutes of running, and I don't like running. So I like Coke, but I don't like running.
And
So
what about
that
this
is not going
bad
to work
news
for
about
me.
a margarita? 60 minutes of, it's funny because you think about when you do have this kind of diet, you do put on weight. And as you get older, here's the other challenge. Your basal energy expenditure begins to go down. Your body doesn't take as many calories to run itself, and unless you change how you eat, you put on weight. I used to weigh 160 pounds. And I could eat like a pig. Now I weigh 180 pounds. I actually have to think, okay, what am I eating today? I mean, this age thing, you got to catch up to what happens to you in aging, because there's a lot of change.
You can
folks.
only hold off age for so long. Kelsey, thank you, first of all, for just showing us some simple things we can do and to help us kind of start our day out, keeping some of those things in mind. Yes.
And thanks for putting up with Hawkeye. That is a
That's
big
right.
job.
How's he been
Kelsey.
doing by
Well
the
done.
How did he do, by the way? Did he? Oh, you're still working on it. Okay, you're working on it.
Did you see him look hard? He looked hurt when I said he had to put up with Kelsey.
I know, right? All right, so don't go easy on him. Be very strict, and get him back in shape, would you?
Got it.
Make him earn it, Kelsey. Make him earn it.
Make him earn it. That's
Yeah,
right.
my patient said I was fat.
One of your patients said you were
So-
fat. All right.
You don't look fat.
I mean, we'll see.
All right, we're going to get to some community questions here in just a bit. So, Kelsey, stay close by because we may have some for you. Do we have any reporter questions on the line, though? I think we are good. Okay, so Isaac says, what about getting an ice cream cone at Betty Ray's after walking from Westport down to Waldo? I like his thinking, Kelsey. What about that? At least when
It's
you're going to do
probably in
something
there.
to
It's in some
incorporate
range.
exercise.
As long as it was a brisk walk. Right?
Brisk walk.
Not
But
an
Kelsey,
hour.
that's-
Not just strolling.
But
Yeah,
seriously,
you're right.
that's a good way of looking at it. Hey, I'm going to do something, but I'm going to kind of earn it a little bit.
I'm sorry, I didn't exactly hear what you were saying.
Well,
but
That's okay.
Here's what it is. Think about it. Westport to sorry, I live in that area, right? Westport to Waldo is about 20, 25
Yeah.
blocks, okay? And you're doing it twice. 50 blocks. Okay.
That's okay.
That's
Well,
about 4 miles. You're there.
Kelsey, what we were talking about is just kind of the incentive to say, hey, I'm going to go get an ice cream cone, but I'm going to walk with my family down to get it and walk back with it. And even though, yeah, they kind of certainly cancel each other out, if that, at least there's something mentally where you feel like you're earning it a bit, right?
Correct. And I tell people a lot to not have the sugar in their house because for that reason, if you really are wanting it, you have to, and the best way is to go for a walk, go get it, because if you're willing to do that, then that's a treat that you really are wanting that day, and you expended the energy or some energy to at least go get it, as opposed to when it's in your kitchen cabinet or in your freezer, and it's just real easy to walk over, and that's about 10 steps, as opposed to 50, a couple blocks or a lot of, so for sure, that's looking at healthy lifestyle. That's a great way to start incorporating the best of both worlds into a healthier lifestyle.
If you want it that bad, you got to walk. You got to walk for it. Joe Ellen wants to know, Kelsey, how about some exercises for the crowd who is out of shape and over 70? Same thing, or is there anything less intense for someone who's maybe starting out?
Yeah. So again, depending on your fitness level. First of all, I would encourage anybody that is kind of curious to look up anaerobic exercises. So if you Google search that, it's going to give you a lot of different options, and it's going to give you a lot of modifications. And so when you're just starting out, again, your body weight can be enough resistance to use our anaerobic system. So starting with squats, just body weight squats instead of a banded squat. You can start with a shorter range of motion if you have bad knees. One thing I like to do that I know I've done on some of these shows before is using your couch at home. Sit down on your couch, stand back up. Sit down on your couch, stand back up. Make that, do that 10 times, make that an exercise. You can do things like, instead of a push-up on the ground, you could do like a push-up against your wall, where that way it's a great beginner exercise that you can build up strength. You're still using those systems, but it is less impactful on your joints when you're first getting started.
Yeah, for someone who maybe it's hard to get down on the ground or have bad knees or something. That's a really good idea. Joyce has a question, just a couple more community questions. Dr. Seitz, let me know if you can answer this. If a diabetic of 30 plus years is in their early 70s, loses enough weight to put them at a decent BMI, plus gets their A1C back down to 6.9, has that person improved their odds of not getting Alzheimer's? Can you make that calculation?
Yeah. Because I think there's clear data that demonstrates that the better your glucose control, and that A1C is the right measure. If you get down under 7, if you can get under 6.5, then the likelihood of cardiovascular disease, stroke, heart attack, Alzheimer's, all that begins to drop. The more out of control your diabetes is, the more difficult the outcome. And for people that who are overweight and have an A1C in that 10 to 12 range, things are going to be tough. Do not expect a normal life expectancy, right? Because you're not doing the things that lead to that. Then if you want to have a longer life expectancy, first you always got to overcome your own genetics, but then you've got to really go back to our basic diet plan. Eat right and exercise well.
Makes sense. All right, let's get to some final thoughts. Dr. Nawalanic, first of all, you're a big bike rider, right? You've been biking out there?
I'm so ashamed because the weather, like in California, it was year round I was riding. Here, winter, I'm just like, no, I'm not doing that. So I've got to get back out there, and I will.
What's your guilty pleasure food-wise? What is the one thing that you can not say no to? Your Bliss Point kicks in.
Chips, man.
Chips.
Salt and vinegar chips, man.
Oh, yeah. Those will
Doritos, man. Those are the two. I can't stop them,
you
man.
Can't. I know. I do. I'm with
but
you.
I do.
But any just parting words, just as we kind of get closer to another weekend where some of us take a lot of cheat days and cheat times, but we also have a chance to get out there and be healthy. What are your thoughts?
Thoughts are that as has been said more times than we can count tonight or today. Tonight, I'm doing great here. Moderation is key, and also Dr. Hawkinson referenced the Mediterranean diet, and when asked about the relationship between sugar and depression, that is kind of questionable. But there is a distinct relationship between the Mediterranean diet and depression, in that there was a clinically significant diagnosed depressive group that was just given the Mediterranean diet for a month. They weren't given any therapy, no medication, and at the end of that month, they showed a statistically significant decrease in depression. That tells you the amount of impact that what we're choosing to eat and the choices we make around that, it really can change the way you feel, and it also can change your lifestyle. So keep in mind, this is your life, your body, your vessel. However you choose to craft it is up to you. And non-communicable diseases is the biggest threat to global health, not just national, but global health. And so we need to be mindful of that and try to make better choices that takes care of ourselves and takes care of each other.
You're like the fourth doctor, I think, just in the last 6 months who's come on to talk about mention the Mediterranean diet somewhere within in their advice. So
and the beauty is it's not something that's marketed. There's no you don't have to order a special package of it's
your own choice.
It's in your grocery store. Go get the stuff, make the foods.
Good tip.
And as you're making them, it's a communication to yourself of your value and your worth.
Thank you so much for being with us today. We appreciate it. Kelsey, I want to head out to you for a final thought, but I also have a quick question from Deb. She's one of our faithful viewers, and I wanted to ask this for her. She says, I do 20 stairs a day about 30 times. Is that considered exercise?
Sorry, again, I get a little bit of feedback, but mostly what I tell people all the time is a little bit is better than nothing at all. So start small and make exercise part of your daily routine, whether it's doing it during commercials. I'm a big fan of just making it something that's functional in your life. If you don't have time to get to the gym and log a bunch of time to get there and work out and shower and get on with life, every commercial break, get up and start doing some squats, start doing some wall push-ups, do some crunches, do some exercises. And if you do that for a 30-minute show, and every break you're giving yourself 2 or 3 minutes of exercise, and then you can sit back down and watch your show, that makes a big difference. And when it comes to sugar and the way that we eat, those are the ways to start combating that and start making it part of your lifestyle and creating a healthier you.
You got to start somewhere. Kelsey, thank you so much. I know you probably have some clients waiting there in the wings for you to get on with it. So I'll let you get back. Thank you for being with us today. Dr. Hawkinson, final thoughts from you today.
Just going to echo Dr. Nawalanic and Kelsey. These things are tough. There are a lot of things going on in everybody's lives. It just takes thoughtful decisions, and it takes that first step to do that. We know how to do that. We know the important things if you are grocery shopping, as Dr. Nawalanic said, it's a lot better to stay on the outsides of that grocery store rather than in the internal aisles there where all the processed foods are and things like that. Again, with economics too, we know it's a little bit more expensive, but there are other cheap ways to do it. So it just takes those thoughtful decisions.
Dr. Stites, you have earned your chocolate chip cookie today.
I did. I'm going to go have one, as a matter of fact. But here's the deal. I think as we go from pandemic to endemic, in the pandemic, we told ourselves, I know I did it, comfort foods. How many chicken nuggets or fried chicken and chips and things, French fries did I have? The answer was a lot. And I paid a few prices for that. Now we're moving into endemic. And what does that mean? It means it's time to make sure that we treat ourselves and take care of ourselves the way we know will be best. And here's the deal. Remember this. What you put in is what you're going to get out of it, whether it's in life, how hard you work, or what you eat. So if you put bad stuff in, you're going to get bad stuff out. Mediterranean diet, healthy diet, the right part of the grocery store, sugar in really good moderation. And remember, you can have a lot of great food that doesn't have to have a lot of sugar, but be a label reader, look and see what it says. Because now that COVID is endemic and much less of a threat to our life, don't let bad decisions affect that.
All right.
Let's all enjoy the recovery together.
Yeah, love it. Well said. We have wrapped up, and now we're going to head over to Alexis Del Cid, who's joining us from Studio B with a preview of this morning's episode of All Things Heart. Looking forward to it, friend. How are you?
It's a good topic this morning, Jess. Coming up at 10 a.m., we're talking about breastfeeding, specifically a new study that was released by the American Heart Association that says women who breastfeed have a much lower risk of heart disease and stroke. We're going to talk with a cardiologist and also 2 lactation experts for a deeper look into this study, though, and they're going to tell us how all moms could apply this to our lives. And also, we're talking with a mom who got some life-changing guidance from the lactation clinic here at the University of Kansas Health System. On the day we catch up with Kansas City mom of 2, Shannon Cochran, it's just her littlest baby Reese, and a big fluffy dog named Maggie. Bubbles! Reese's big sister, Remy, always the social butterfly, is at preschool at a hat parade. Shannon's little family is clearly her source of all things joyful. But when she first became a mom, she says she was rattled at how difficult it was for her to breastfeed.
And it really lies on the mom to do it because nobody else can. So that was, I think the responsibility, but also just how much time it took was the most surprising and probably the hardest for me.
And she was so incredibly grateful her doctor referred her to the University of Kansas Health System's lactation clinic, where the lactation consultants and nurses helped her navigate everything from proper positioning, burping, even issues with engorgement. It made a world of difference for when she had baby number 2.
Having the experience and the history that I did with the first helped make this a really easy transition.
So when we tell Shannon about the study from the American Heart Association showing that women who breastfeed at some point in their lives are less likely to develop heart disease, have a stroke, or die from cardiovascular disease compared to women who do not breastfeed, she is happy, but she's also aware of how many other factors contribute to a new mom's heart health.
The resources, having great insurance, having a job that allows me to have insurance. I'm fortunate to get a 4-month paid maternity leave, which most women do not.
So Shannon has a message for the rest of the world when it comes to new moms.
Give new moms grace. If they're going to be a little bit late for work, trust that they're still going to do their job. It's hard. It's really hard to manage all of it, and if they're showing up and doing their job, that's enough.
So coming up at 10 a.m., we're diving deeper into those other factors at play that Shannon talked about, because our health experts also say that there is a profound gap between new moms who have all sorts of resources and new moms who do not have those resources, which plays a role in heart health. So we're going to talk about ways to close the gap so that all moms have a better opportunity for healthy hearts. That's coming up at 10 a.m.
Really interesting connection, Alexis. We'll be watching. Thanks so much. Well, from heart to cancer now. The annual NACTO PAM conference now underway in Kansas City wraps up here in just a few hours. The event lets cancer communicators share ideas on how to better inform doctors and us about cancer and the treatments out there that are available. We spoke to some of those here from out of town that are at the conference, and here's what they had to say about KC.
As we all know, Kansas City is a tremendous town, and we want people to come here and see what we have to offer.
Good weather. We were just talking about the river walk, so excited to go down there and excited to see the museums.
Barbecue? Long term, we want to keep growing and getting a little bit bigger, but for now, I think short-term goals are just to get some really good barbecue.
We want to make sure that our cancer center is seen as a leading institution throughout the country.
Just hearing the different perspectives from all over the country of people all with the same goals, with different perspectives to make a difference in the work that we do.
I think getting the word out is an important part of that.
Where are you from? Michigan, University of Michigan Rogel Cancer Center.
I'm from Philadelphia, from Fox Chase Cancer Center.
And when you have the convention, you host the convention for the people who are responsible for getting the word out about cancer centers, I think that's a good step for us.
I think what we've been looking forward to and just really getting a lot out of NACTO is hearing from others who get it.
And finally, this morning, for all of you folks out there who work in an office, you know how important those administrative assistants are. And it's the same for us here in our department and on the morning medical update. Yesterday was Administrative Professionals Day. So, of course, we all had to say a big thank you to Kaylee Cousins. She helps us with booking our guests and just about anything else that we need for our show here. So to say thank you, we got her a card and some treats and snacks and all the good stuff, showering her with our appreciation. So it's not just us who is so thankful for Kaylee, but you can also meet Kaylee's daughter. She really loves her mama. That's Charlie, and we hope Kaylee shared some of those sweets with her daughter. So thank you for sharing her with us, and thanks to her family for letting her be here and taking care of us. She probably takes care of us just the same way she takes care of Charlie. So thank you so much, and thank you for being with us today. Don't forget you can catch our shows anytime by logging onto Facebook, YouTube, and Twitter. Have a great day, and we will see you tomorrow. Coming up tomorrow on the Morning Medical Update. It's a weekend full of events and galas here in the Metro, from the AIDS Walk to Beat the Odds for Epilepsy, how you can help your neighbors, doctors, and researchers in their quest for a cure. We'll see you Friday at 8 on these social media channels.
Subscribe to our Morning Medical Update and Open Mics with Dr. Stites podcasts. Now, everywhere podcasts are available.